I'm Christophe Willekens from France in Gustave Roussy Cancer Center. And my colleagues and me, we presented at ASCO and we present here at EHA the results of a retrospective study where we compared a reduced dose of Venetoclax to 7 days associated with azacitidine in acute myeloid leukemia patients who are ineligible to induction chemotherapy. And we compared that cohort of patients to patients from MD Anderson Cancer Center who were treated with a standard dose of Venetoclax for 28 days every 28 days. So the first point of our study is that the cohorts are not so well balanced because first they have our cohort is full of patients with severe comorbidities. Near half of these patients have exclusion criteria to clinical trial. And conversely, in the cohort from the MD Anderson Cancer Center, the patients were, for a large part of them, included in clinical trials. So they are fit, and the cohort who received 7+7 was not fit. Secondly, concerning the AML characteristics, we have some difference. So especially for FLT3 mutation and RAS mutation, but so we cannot conclude and easily compare that kind of cohort. But what is very interesting in our study is that when we compare response rates between these two cohorts with different scheme of Venetoclax duration, the response rates were the same. So that's a good point, and it seems that reducing Venetoclax is not inducing less response. The second point is that when you treat this frail patient with 7 days of Venetoclax every month, you will induce less early mortality at 8 weeks. This is significant compared to patients who received a standard dose of Venetoclax. So this is, I think, the major point of our study. So it's maybe the early mortality is lowered because we lowered the toxicity of the treatment. And concerning the survival results, we don't have a long follow-up, but it seems that for patients with TP53 mutation or FLT3 or RAS mutation, we don't have difference between the cohort. For patients who not have this kind of mutation, results are difficult to interpret because the survival results are exactly the same for during the first year, and after that we have difference. But this difference, I don't think that we will have clear answer and explanation to that observation, and this is the reason why a prospective trial is needed, and this is what we are working for today, and I hope that we will open this randomized phase 3 trial as soon as possible.